So today we are going to discuss about patient counseling, its definition and the 4 steps for patient counseling we have already discussed in the last class. So now I am going to the communication skills needed for effective counseling. The counseling process usually uses basically 2 types of communication skills: verbal communication skill and non-verbal communication skill. In coming to the verbal communication skills, it include first one, language. Whenever the pharmacist is counseling a patient or patient relative, always he have to use the layman language, and he has to explain the counseling thing in the counseling matter in the simple words, and also he has to avoid all the maximum medical words when in the time of communication or in the time of counseling. Next one is tone. So, changes in the level and range of pitch convey information about the feelings and attitude of person speaking. Tone of voice should be caring and reassuring. So whenever the pharmacist is speaking, his tone will be always in the manner of a caring and reassuring. He always the tone should always say the patient should be always comfortable in the tone of this pharmacist voice. Volume. The counseling should be conducted in a quiet, private settings where it is unnecessary to raise one's voice. So, whenever we are selecting a counseling area, it should be quiet and it should be in a private area. So, the pharmacist need not has to speak in loudly in the during the time of patient counseling. The pharmacist not need to speak loudly, and speaking less volume or in an intermediate volume will also make the patient also comfortable to say something about his disease or his to ask some questions which he did not like to share in public. That's one point. And what if we are speaking to a person or patient who is having a hearing problem? So in such case, the pharmacist has to speak more loudly. So in that case also, if the counseling area is in a private place, it will help. And the speak in wide variation of volume depending upon where and whom you are speaking to. Next one is speed. The clarity of our communication depends upon our rate of speed. The pharmacist should present clear, relevant messages in a logical sequence and at a speed which gives the patients to think about what is being said. Use of open-ended questions. So whenever a pharmacist is giving the counseling, always he has to use an open-ended question. Open-ended question means it always starts with who, what, where, when, why and how. The answers to a closed-ended question will not reveal anything about the understanding and recollection of the information. Closed-ended question means yes or no question. So whenever a pharmacist is asking a closed-ended question to a patient, he will only give the answers like yes or no. So what the pharmacist can understand from that? He will only understand whether the patient is knowing that. Do you know for what this drug is taking? The patient is giving answer like yes. Further thing, the pharmacist not understand, don't understand. So pharmacist have to ask the question like this: for what this drug is taking? Can you please explain for what this drug is taking? So then the patient can give an explained answer. So from that answer, the pharmacist can understand the knowing of the patient about his drug. Next one is use of paraphrasing. Paraphrasing means active listening. The pharmacist also always has to act as he is actively listening to the patient. Also that will help the pharmacist to collect the good clear information from the patient. Whenever the patient is speaking, the pharmacist have to actively listen to the patient words. Then only the pharmacist can understand what the patient had told him, and then only the pharmacist can give a effective counseling to the patient. And also, when a patient is seeing that the pharmacist is clearly listening to me, the patient can will get a confidence that he can tell this pharmacist he is hearing to me, so I can tell him about my problems, he will give me a solution, like what one thinking is coming to patient. So active listening is one of the qualification to a good patient counselor. Next one is assertiveness. Assertiveness means an atmosphere of trust. So whenever a pharmacist is coming for a patient counseling, he have to create an atmosphere of trust, so that the patient will understand that whatever he is saying, whatever the problems he is sharing to pharmacists, it will confident, it won't go out to the public. So these are the verbal skills. What all are that? Language, tone, volume, speed, use of paraphrasing, assertiveness, and open-ended questions. The next one is non-verbal skills. In that, first one is eye contact. So no, not at all, not in counseling, but also we will say like that, whenever we are speaking to another person, always we have to keep an eye contact with the other person. That is the that will show the mannerism in a communication, or that means the both patients are in good communication. So whenever we are speaking to a patient, by looking to his eyes, he will be more confident to share his problems with the pharmacist. So, but in some conditions, when the patient is in mental illness or mental depression, or physically he is in depression, he may not give us a eye contact. So in that conditions, we can exclude this thing. Facial expression. So this can be used during counseling to demonstrate empathy towards the patients. Head movements like nodding, hand gestures, and body postures also can be used to advantage. Proximity means the distance between the counselor and the patient. So normally the healthcare professionals or the patient counselors, they are always use an intimate or personal proximities. Intimate proximity means there will be a gap of 45 centimeter or less between the counselor and the patient. Personal means a gap of 45 centimeter to 1.2 meter will be there between the counselor and the patient. Social means 1.2 meter to 3.6 meter gap will be there, and public means more than 3.6 centimeter meter 3.6 meter gap will be there between counselor and the patient. Next one is mannerism. The patient needs to make the pharmacist needs to make patient seat comfortable by enhancing physical and psychological privacy. So the gesture, clothing, hygiene, everything of the pharmacist will make patient more confident to sit in front of him. What if the pharmacist go counsel try to go dress like a film star, or if he is trying to dress like, whether he is going for a fancy dress and he's going and sit for talking to a patient, what the patient will think, why this mad person is coming to me, like that only the patient will think. So whenever a professional pharmacist means he will be professional. So whenever a pharmacist going for counseling a patient, he should be in a professional look, and he should be, the hygiene should be showing there, and the gestures and his facial expressions and the body movements, everything will be in a manner to comfort the patient in front of him. Listening. So a pharmacist should be a good listener. What this is the same point what we have already talked in verbal skills. So the pharmacist should rid him or herself of distraction to the patient, ask clarifying questions where appropriate, and avoid jumping to conclusion. He must allow the patient to speak without interruption and concentrate on the words of the patient. So, listening to the patient is important for an effective communication. Last one is touch. So, it can enhance the verbal communication, facilitate the interaction with the patient. Coming to the counseling area, as we have already told, the counseling area should be in a private area, should be in a quiet area without any distractions of other people. The patient should perceive the counseling area as confidential and secure, so that they will ask questions which they hesitate to ask in public. So that's all about the steps and the communication skills during patient counseling.